Hi there, my name's Kiran Patel and I'm a specialist physiotherapist working for the Leeds Long Covid Rehabilitation Service. So I'd like to share some of the work that our service has been doing to address health inequalities and inequities for people who are experiencing long Covid. So the main things I'll be covering today are a brief update on the service itself, some data on long Covid, the reasons why we're covering health inequalities and inequities, and I'll be sharing some of the work that we are doing and some of the groups that we're hoping to sort of reach out to. Okay, so to recap, long Covid or post-COVID-19 syndrome is a term that's used to describe symptoms and signs that are ongoing or persist sort of 12 weeks or so after a COVID-19 infection that have no other alternative explanation. So the long COVID-19 rehab service was originally set up in September 2020 on the back of the pandemic to help support people who were still experiencing ongoing problems with relation to their long Covid. We are a community-based integrated care service working with primary care as part of the community services as part of Leeds Community Healthcare. So we are a service led by clinical coordinators of AHP background who provide a multidisciplinary approach focused on rehabilitation. So the team consists of occupational therapists, physiotherapists, dietitians, psychologists, technical instructors, medics and a dedicated admin staff. Following GP referral, we then screen the referral, send communication to the patient to opt into the service and complete questionnaires based on relevant health outcomes. The patient then receives an initial assessment in a group or a one-to-one format, followed by further intervention in either a virtual, telephone, clinic-based or home visit setting. To help with understanding the process and ensuring that people who are aware that we are a rehabilitation service, I have shared our service leaflet, which has been included in the resources, which can also be made available in other languages, braille, audio or large print. So we also perform a weekly MDT with a cardiologist, a respiratory and a rehabilitation consultant to seek further medical advice and also to discuss more complex patients. There is also an interdisciplinary research team who liaise with our service and provide ongoing input for research projects that are still going on. We will also be providing further updates and service information in the weekly primary care bulletin. Recent ONS data estimates that 3% of the UK population in private households have self-reported long Covid. Interestingly, these are people who are aware of what long Covid is and are actually able to self-report. 76% of those with self-reported long Covid report that their day-to-day activities have been affected. Fatigue, breathlessness and cognitive concerns are the three main symptoms reported by people suffering with long Covid. As a proportion of the UK population, the prevalence of self-reported long Covid was greatest in people aged 35 to 69 years, females, people living in more deprived areas, those working in social care, and those with any other activity-limiting health condition or disability. So, data on a further slide suggests that despite ONS reporting people suffering with long Covid are those in more deprived areas, we're actually getting lower referrals from those GP practices in more deprived areas. The reason why we decided to address health inequalities and inequities in long Covid was because people living in areas of high deprivation, people from Black, Asian and minority ethnic communities, people from those inclusion health groups, which are people from homeless backgrounds, people from the Gypsy, Roma and traveller community, and those who are most at risk of experiencing inequalities. Health inequities are unfair and avoidable differences in health across the population and between different groups within society, whereas health inequalities are the unfair distribution of resources. NHS England created the Core 20 Plus 5, which is a national NHS England scheme to help reduce healthcare inequalities at both a national and system level. So the Core 20 describes the most deprived 20% of the national population as identified by the National Index of Multiple Deprivation, or the IMD. The plus part is the population groups we would expect to see identified as the ethnic minority groups, people with learning disability and autistic people, people with multiple health long-term condition, and groups experiencing social exclusion, known as the inclusion health groups. So those inclusion health groups, like I said before, include people from the homeless background, vulnerable migrants, people from the Gypsy, Roma and Traveller community and refugees. So, as this graph shows, the top 5 most deprived IMD deciles is underrepresented in our service uptake relative to the IMD population size proportions. We also identified that 7.1 million adults in England read and write at or below the level we would expect of a 9 to 11-year-old. Also, approximately 45% of people in Leeds have lower health literacy. The groups that we've decided to work on, based on the data discussed previously, and also the NHS England guidance, are people with a learning disability, people from the Black, Asian and minority ethnic background, people who are asylum seekers, refugees or migrants, people from the Gypsy and Traveller and Roma community, people from the homeless background, the elderly population, and also people who experience health or IT illiteracy. So now, I'd like to discuss some of the work that we're aiming to do with some of the groups discussed, and also some of the work that's already been done. Ultimately, we're aiming for our service to be more accessible, we are hoping to raise more awareness of what long COVID is, and we are also aiming to improve health outcomes in that population. With colleagues from other healthcare trusts, we have been working on people who experience a learning disability. We have designed a new booklet which has been adapted into an easy read version. We have lowered the threshold for referrals into our service for people who suffer with long COVID from 12 weeks to 6 weeks, and they will also be prioritised. We're also proposing that people who have their annual GP review with a learning disability have long COVID added to their checklist, which has also been included in the resources shared. So far, we've had 0 referrals for people who have a learning disability into our long COVID rehab service. So, to help reach out to the elderly population, we've created some posters which are shown just here. These posters have been shared with care homes and neighbourhood teams in the community, and the aim is to help with the understanding and recognition of long COVID and the symptoms associated. So, our main aim with the inclusion health groups, so these are people who are homeless, who are recognised as being refugees, asylum seekers or migrants, or people from the Gypsy, Traveller or Roma community, is to raise awareness primarily. So far, we have presented to the York Street GP practice, with the aim again to raise awareness of what long COVID actually is. We also aim to work further with GP practices in more deprived areas. We are planning to attend pop-in centres that people from the homeless, refugee, asylum seeker and migrant communities attend, such as St Anne's, Pathras and also the Migrant Access Programme. We're also planning to attend weekly sessions at the Gate Community Hub, with the ultimate aim again to raise awareness of what long COVID is and help with the understanding of how to refer into our service. We have developed a patient leaflet to raise awareness of what long COVID is and to encourage referrals via GP. This has been shared with primary care and also third sector organisations and can be made available in several different languages as shown here. However, we do recognise that people from more deprived areas do have difficulty accessing their GP practices. We are therefore working on a more direct referral form to reduce this barrier and encourage more access for care. So as shown here, we've created a direct third sector referral form. This will be piloted in the upcoming months. Patients will still require support from medical or GP practices to ensure the primary care assessment has been done to rule out any other contributing pathologies or problems. So to summarise, we are the Long COVID Rehabilitation Service and we are dedicating work to address healthcare inequalities and inequities for those people suffering with long COVID in more deprived areas. We aim to raise awareness, to make our service more accessible and to improve health outcomes in people from those more deprived areas. So your pivotal role in ensuring that we provide this ongoing support is to make sure that you help identify and support people who are experiencing potential long COVID and referrals into our service. Our contact information has been provided on the slide here and also some resources will be provided. Thank you again for listening to my presentation.